I'm Ken Altucker with USA Today. I cover healthcare. I'm here with Tom Frieden, who is the former director of the Centers for Disease Control and Prevention and now CEO of an organization called Resolve to Save Lives. Dr. Frieden, thanks for joining us.
Thanks for having me here.
So we're really in unprecedented times. Last night, you might have seen the coronavirus task force update. And in it, President Trump seemed to be pushing for a call toward starting up the economy. And I think a lot of Americans are wondering right now, how long are we going to be in this situation of social distancing, working from home, and in some cases, unfortunately, job losses? So what are the risks and benefits to transitioning?
That's exactly the right way to think about it. What's the cost and what's the benefit? And right now, it is understandable that people are wondering. First off, this is unprecedented. There's never been an action like this. Second, for most Americans, the risk is extremely low. So people may think, isn't this an overreaction? And yet, if you think about it, it's crucially important that we do several things. First, we reduce the force of infection so that our healthcare system isn't overwhelmed. Sadly, I'm in New York City today, and sadly, our intensive care units are near maximum capacity. And over the next 1 to 2 weeks, it's quite possible we will see really catastrophic scenes of patients unable to be safely cared for. Unfortunately, we're already seeing many healthcare workers get infected with this virus. So it is a true emergency. And if we don't shelter in place, we're going to see that number continue to increase exponentially and outstrip our healthcare capacity. But there's a second reason for the sheltering in place. It's not just to tamp down the number of infections. It's to give our system time to ramp up its capacity to treat patients who have severe illness, capacity to manage large numbers of people who may want to have testing done, and our capacity to do that safely without infecting healthcare workers, and the capacity of our public health system to test large numbers of people, to identify contacts, to quarantine and isolate patients, to trace contacts. These are all crucial functions. And the sooner we get that done, the sooner we can begin to go out again. And when we do that, it's important that we do it in a controlled fashion. We don't open the floodgates, but rather turn the faucet carefully so that we can steadily have an assessment of, is there an increase? Can we manage it? Can we handle the patients who get very ill? And there are sensible ways that we can reopen steadily without risking overwhelming our system, which frankly would result in a much longer and even more disruptive closure.
So we saw this first emerge in the US in Metro Seattle, the first patient, and that seemed to be the first hotspot. Now it's gravitated toward New York and maybe California, Los Angeles. Is this a situation where individual hospitals are going to get to the point where they really can't handle their intensive care units, their respiratory therapists, their ventilators? What's the worst case scenario here in terms of a capacity jam?
The real concern here is that we could far outstrip the capacity of healthcare, and any city, really any city in the world that gets a big outbreak of this coronavirus is going to have a really difficult time managing it, because the number of cases can be very, very large. And the duration of time that people may need to be on a ventilator could be 2 or 3 weeks. And there's really no city in the world that could handle a large outbreak effectively. That's why it's so important that we increase social distancing now. That's why it's important that everybody wash their hands, cover their cough, not go out if they're sick, and contact their local authorities to determine whether they should get tested. Right now, today in New York City, the strong advice is if you have mild illness, don't come in to get tested. If you do so, you're going to use up precious materials that other people need more: healthcare worker time, protective equipment, swabs, test kits. And in the process of going to get tested, you might infect somebody. And if you're positive, it's not going to change anything. People are going to say, stay home. So stay home in the first place. If you have difficulty breathing, by all means, come in for care. But in addition, if you don't have infection, you could get infected in that process. So sheltering in place is very important now, but it's going to be different in different parts of the country at different times. And the key is to open as soon as safely as possible.
Initially, the CDC seemed to have some stumbling blocks in getting testing kits mailed out, workable testing kits to states and local public health labs. How big of an issue was that in our slow response?
Definitely the problem with test kits, not just from CDC, but also the FDA allowing private hospitals to develop their own tests. That was quite delayed, and getting the private sector in with HHS and the private sector working together to get private labs doing this. All three of those put us really behind in our response. The CDC tests are for public health departments. They were never going to be enough for the entire need for the country. But the problem with the CDC test kits did delay our availability, our awareness of where and when and how this virus has been spreading, and it's put us behind.
Was it a matter of planning or execution?
In the past, the CDC test kit production facility has worked extremely well. This goes back 2 administrations. It worked. It was developed under George W. Bush. It was expanded under President Obama. In the 2009 H1N1 response, it worked extremely well. The virus was identified in mid-April. Within 2 weeks, CDC had developed a test, validated it, and gotten it approved by the FDA. 3 days later, it began sending out 1 million tests to every state in the US and more than 100 countries around the world. I know because I was health commissioner in the US at that time, and we received them in early May. And when I was director of CDC for years and I traveled around the world, country after country thanked us profusely for developing them and providing them so promptly and in large number and high quality. So this is not a problem that's happened before. We need to figure out what went wrong, but more importantly, we need to move forward and understand the role of testing in the overall comprehensive response to this pandemic. It has an important role. Every patient in the United States with pneumonia today should be getting tested. And where there are areas that have the ability to try to contain it, to suppress it, to find all the infections, these drive-through testing facilities and potentially self-swabbing may have an important role. We also need to learn from other countries what really worked in Korea to have the progress that they've had. What has China done? We are all in this together. There is no enemy here other than a dangerous microbe, the coronavirus. And it's not a time for countries to be fighting with each other. It's a time for our working together to have the best possible response, because what happens anywhere in the world is going to affect us. The more this is spreading around the world, the greater risk Americans will have.
Are Americans hearing mixed messages from the administration during past outbreaks like H1N1 and Ebola? We had steady and consistent communication from the scientists at CDC. Now we have a coronavirus task force. Is the American public hearing what they need to?
I'm deeply concerned by the apparent absence of the Centers for Disease Control, both at the decision table and at the podium. CDC has been around for nearly 75 years. In every single infectious disease response this country's been through, CDC has been central to that response. Not having them there makes us less safe. I will feel safer when I know with confidence that they're able to give their expert information, advice, expertise, input into the decisions that are life and death decisions. The Centers for Disease Control has many different centers. One of those centers is the Center for Immunization and Respiratory Disease. They have over 700 public health professionals who have spent decades studying exactly this type of problem, an infectious disease, viral illness that affects the lungs. These are the experts. And if we're fighting this without them as central to the fight, we're fighting it with one hand tied behind our back.
What can an individual do in a situation like this? There's an awful lot of loss of control for individuals, whether it be job loss or in some cases, the inability to be tested. What should people do?
There's a lot that we can do as individuals and as a community. We need to come together at the same time we're socially distancing from one another. That means the basics everyone has to do. Don't go out if you're sick. Wash your hands regularly. Cover your mouth and nose when you cough and sneeze. Check with your local authority to see if you should be tested if you have mild symptoms. If you are ill, isolate yourself. Make sure that you stay 6 feet away from everybody. If you've been exposed, quarantine yourself for 14 days. All of society is needed for an all of society response. And that means economic support for those who are having difficulty. That means teleschool for as many kids as can go to school through distance. That means figuring out how to adapt so that we can open as soon as safely as possible and protecting our most precious resource, which is healthcare workers on the front lines.
How do we get out of this?
This is going to be a long war. This is not a quick fix. We don't know whether the weather will change the behavior of this virus. We do know that we can change the behavior of this virus. If we distance from others, we can tamp down spread. If we strengthen our healthcare and public health systems, we can control flare-ups of the virus. If we focus on getting rigorous studies done on what works to treat this virus, if we can find a medication and move forward toward a vaccine, we will have more weapons in our war against this virus. And one of the weapons we need to get better at using is information. Information about the virus. We need to understand more about how it spreads, who's at most risk of getting it, who's at most risk of getting severe illness, whether children spread it, whether people without symptoms spread it, how we can protect our healthcare workers most effectively. All of these questions have immediate ramifications. That's the kind of thing that state health departments, local health departments, and the CDC are best at doing, getting them and the academic medical centers finding out more so we can do more to protect people is crucial to making progress here.
Is there a lack of trust in science? We've seen it with the anti-vaxxer movement. We see it with the spring breakers out in South Florida, not practicing social distancing. Is there a crisis in public health communication in this country?
I think for many years, we're seeing an erosion of authority. We're seeing the expansion of people relying on social media. We see younger people maybe not seeing the difference between a tweet sent by one individual and a statement by someone who's the world's expert on that. That's our world. And we need, as the experts in the world, need to get better at using social media, at telling stories that people can understand, of following the risk communication guidance that the Centers for Disease Control and Prevention issued. Be first, be right, be credible. Tell what you know, tell what you don't know, be frank about it. That's the best way to bring people on board. People are adults. They can live with the information. Yes, there are a tiny number of people who may have conspiracy theories and you can't get them off that, but that's a tiny proportion. Most people, when given information freely and openly, promptly and clearly, will understand it, will act on it, will ask reasonable questions and take reasonable action.
Dr. Frieden, thank you for joining us today and providing clear, concise answers in this time of really unprecedented situation we're facing in this country. I appreciate your time, and please join us at usatoday.com for ongoing coverage of the coronavirus, and have a good day.
Thanks very much.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.